we're almost at the end. I say almost because I can talk for days. But this is a great topic to help the patient understand what's required from them after their treatment is done. Okay, so that's very important because that's what's gonna make things last. Okay, and prevent complications as much as possible. And if there's complications, it will minimize them and keep them very manageable. So the first thing is seeing your dentist on a regular basis so they can do exams, checkups, and cleanings depending on your situation. So everything is monitored very closely, and if there's an issue, it's caught very quickly. Also, wearing a night guard. We talked about the stress from the bite. This is something that will help reduce that while you're asleep and you're not in control of what's going on. And that's something that we give to all our patients. Now, the third thing is, practicing good hygiene at home. Brushing, flossing, mouthwash, water picking, just to keep everything cleaned up. Because if you just rely on us to clean things up, things will fail and we end up right where we started, and we don't want to do that. And that's something that we rely on your help with to make sure this lasts for a very long time. Now, I also recommend most of my patients to kind of be on a prophylactic multivitamin regimen. A lot of the population has deficiencies in one or two vitamins, and those can really impact your healing, your ability to fight infections. So you want to make sure that things are staying on the up and up as much as possible. I also recommend that you get a physical with your physician and get yearly blood tests done, just in case if there is something, we can catch it very soon and we can make the changes necessary to make sure everything stays in good shape. Also, it's very important if there's any new diagnosis that come up, any conditions that come up that can affect your healing, affect your ability to fight infections, we need to know about it as soon as possible. Don't go, for 6 months without letting us know that you were diagnosed with, let's say, diabetes, or that, God forbid, diagnosed with any type of cancers and you're about to undergo any radiation or chemotherapy. So those are things that are very important for you to communicate with our office to ensure that we manage, that part, with you and help you kind of navigate through it, with the least amount of worry as possible. I also would say that don't use your teeth as tools, okay? Don't chew ice, don't open cans with your teeth, don't bite your nails. All these are added stresses that will cause issues. So stay away from all these bad habits. And lastly, if there is a problem or you feel there is a problem, let us know right away. That is very, very important. Sometimes it could be something very simple, but if we let it go, it can, trickle down and become something much bigger. So if I feel there is an issue, pick up the phone, call us, we'll get you in right away, and we'll try to manage it and address it as quickly as possible. So this is what I need from you once we are done. And I trust you to get it done, okay? All right, see you soon. Thank you.